So we're now going to look at doing the AED. So with an AED, what would happen is, like, you've started doing the CPR on this poor person here. You do not stop doing the compressions at all. Even when I turn up with the AED, you've said, Paul, go and get an AED. I've gone straight off to get it. So I've turned up. So your compressions are still going on. Yes, continuous. In the AEDs, this is one here, a training one. There are always 3 things minimum in there. There's always large non-latex gloves, which you would put on immediately. There is also shears scissors that you would cut through the clothing if it needs to be cut, or it can be pulled apart and even through bra straps, as well as there's a razor that we need to shave the person. It does tend to be us guys a bit hairy. Of course.
So surely the person is already bare-chested, because I wouldn't be doing compressions through their clothes.
No, you can do compression CPR through clothing. That is not an issue at all. But we do need to expose their chest fully when we get for the AED, yes. And also then, as I said, we need to shave where the pads are going to go. We need to shave any body hair as best as we can away, so the pad sticks to the chest. It's pad to skin without going through like a mountain of hair. Yeah, does that make sense? You'd always get those 3 things in there. This one, being a training one, has a control box in there just so I can monitor what's going on. So what would happen here is you've carried on doing the compressions. You do not stop until the AED tells you to stop. Take your hands off, as well as I will be instructed by you, Paul. Hands off. It's analysing. So here we go. So you carry on doing the compressions. Let's say that you are doing these anyway. I would immediately just put the gloves on. The gloves go on. Like so. That's it. If it goes to be a bit quicker than that, it would have been anyway. But then if need be, I will then get you to stop momentarily, just so we can cut the clothing away, expose the chest, and your hands will go straight back down on there, carrying on. We will then start the AED.
Training scenario. 1. Adult patient. Call for medical assistance.
Which we have already done. We have the phone on speaker.
Remove clothing from patient's chest
which we've already done.
Bare skin. Pull green tab to remove pad.
But again, all this time you're carrying on doing the compressions. You have not stopped. I'll just pause this momentarily.
Paused.
So you're carrying on doing compressions, but you'll see clearly on the pads they're marked where they are to go on the body. Yeah, on this person's body. As I'm using the AED, I will keep the AED nearest to me, my side. So as and when and if it says press the button to shock, it's with me, next to me. I'm not leaning across the person to potentially push the button, because I could get shocked. Yeah, could be serious. So you're carrying on doing the compressions. I will then peel the backs off. Your hands come up, put the first pad down. Second one then comes down on this side. There we go. And you'd carry on doing the compressions until this tells you to stop, which would be now.
Assessing heart rhythm. Do not touch the patient.
So you tell me, Paul, hands off, don't touch. Tell me.
Analyzing. Do not touch the patient.
That's it.
Stand clear of patient. Shock advised.
So the heart should start flashing in a second. And when it does, I will press that.
Press the orange shock button now.
Before I press that, it's really important that the reason we cannot touch this patient when it's analysing is because even if I was to go like that on its own, it would detect my heart rate, my sinus rhythm, and it would then give a false reading for this. Does that make sense?
Yeah.
Brilliant. Okay.
Press the orange shock button now.
There we go.
Delivered. Begin CPR.
So now you would then start CPR.
Touch the patient.
Because if
place overlapping hands in middle of pause.
Because if the first shock didn't work, you would, if it does work, you would know within a couple of seconds, 2 or 3 seconds, it's worked. But if it hasn't, these are geared up as if it had the person, there'd be sign of life. Their eyes would open, they would take a breath, they would be movement of life there. But if not, it's geared up as if it hasn't worked, and it will now talk you through the process of
Press
CPR
directly down on the chest
and how
in
we
time
do it.
with metronome.
And the flashing light is flashing at exactly
Remain
110
calm.
beats per minute as it goes.
Good compressions.
Okay. And it will now,
Paused.
as I said to you earlier on, once we had done the 30 compressions 2 breaths a couple of times, you're going to have to, or I will be doing it with you, the compressions non-stop for 2 minutes. And the reason for this, one of the reasons, is because between analysing, the AED will get you doing compressions non-stop for 2 minutes before it says stop, hands off, analysing. So you've got to be used to the fact or ready for the potential of doing non-stop compressions for 2 minutes. Does that make sense?
Yeah.
Brilliant. Okay. What we'll now do is we'll get you to do this as well. Actually, I'll just let it keep rolling, playing on that. But what we'll do is I will do the compressions. So you can... Where's the other bit of plastic? Oh, there it is. So as you undo this, it'll be the gloves straight on. You'll probably tell me, pull hands off a minute while you use the scissors and cut through, potentially get the razor out to shave. But I'll use that still myself. So the gloves is large, just
So they won't go on again, will they?
no, they'll be fine, these ones, yeah. I'll keep it all undone anyway. So you won't have the gloves on yet, we just put them just in the back, just to show what's going on. Right. Okay.
Right, so I'm coming along with the AED, am I?
That's it. All right, we'll start 2, 3 now. Oh, brilliant, Jane. You've come back for the AED with that. Excellent. Putting the gloves on. And I'll continuously be doing compressions until the AED tells me to stop.
Okay, stop them.
There we go. That's it. If turn it on.
Training scenario. 1. Adult patient. Call for medical assistance.
It will tell you exactly when to do it, yeah.
Remove clothing from patient's chest to expose bare skin. Pull green tab to remove pads. Pull pads from liner. Apply pads to patient's bare chest, as shown in picture. Press pads firmly to patient's bare skin. Pull green tab to remove pads.
That's it. And once you put these on, I'll move it on
Peel
manually.
pads from liner.
There we go.
Apply pads to patient's
So
bare
this will
chest,
continue as we move it on.
Assessing heart rhythm. Do not touch the
Right.
patient.
Do not touch the patient, Jane.
Analyzing. Do not touch the patient. Stand clear of patient. Shock advised. Stand clear of patient. Press the orange shock button now. Shock delivered. Begin CPR.
That's it.
It is
If
safe
we
to
needed
touch
to
the
do
patient.
so. Perfect.